So what are the risks? Before we answer this, you should know that these are common listed risks, and they are more of a formality than anything. In other words, they don't necessarily all apply to a midline insertion. So let's review each of them systematically. Pain or discomfort at the site of insertion. For a midline, we do not use lidocaine at our facility, so while it will hurt, it is not going to hurt as much as it would if you had been stuck in your hand. The hand is responsible for fine motor skills, and an example of that is someone playing the piano. There is precise and quick movement occurring with lots of stimulation to and from the brain. Due to this, pain sensation is increased when there is trauma or damage to the hand. Now compare that to the upper arm that simply just goes back and forth. It does not require as much nerve innervation to have this simple movement occur, and as such, the location of the midline in the upper arm will traditionally hurt less. Puncture of the blood vessel causing bleeding at the site of insertion. This is the name of the game. You're going to have a line inserted into your blood vessel, so there is going to be blood. That lets us know that we are in the right spot as well, so this is an expected complication or risk. Phlebitis or infection of the vein can occur due to foreign bacteria entering into the vessels. Traditionally, it causes a red streak to go up the arm. However, this is usually associated with line contamination during line insertion and rarely happens with midlines. Another risk is infection at the site of the catheter insertion, blood vessel, or other body organs such as the heart or brain. All indwelling devices have this risk, but when there are signs of infection, the healthcare team will assess the location and determine if the line should be removed. In the case of midlines, there is rarely infections at our facility. Most infections have to do with issues with maintenance practices at the bedside or at home when a patient manages their lines by themselves. All lines will be primed before they are used with saline and purged of bubbles prior to hooking up to the midline. This prevents air embolism, and it is a rare occurrence. I have never actually seen or heard of this taking place with a midline. This is more of an issue with central line placement when inserted into the neck. Nerve or tendon injury or irritation can occur, but since this is an ultrasound guided line placement, the nerves, arteries, and veins will be identified before an attempt will be made to insert the midline. As such, it will be unlikely that a needle would hit a tendon or nerve. Since we are only sticking in the arm, there is no way that a 10 centimeter midline could travel to the lung and harm it, causing a pneumothorax. This is more of a complication of subclavian central line placement. If a line was inserted centrally and it entered into the heart, it could tickle the heart and cause it to beat out of synchronization with the body. We would simply need to pull the line back if this occurred. However, with a midline, the line does not cross into the central circulation, and this risk does not occur. We would only be able to know if you had an allergy to the material of the midline if we actually placed it. I have not actually seen this occur or heard of this occurring at our facility in at least 10 years. However, anyone who receives X-ray contrast should increase their fluid intake in order to rid their body of said material. This is not specific to the midline, but instead their radiological test using the contrast medium. The line could be pulled out on accident, and that would simply mean that you would have to have it replaced. We do not suture these lines, but instead apply an adhesive to them so that they will adhere to your skin. Breaking off of the catheter into the bloodstream would be extremely difficult to occur unless someone was trying to cut the line for some bizarre reason. There's no clinical reason for the line to be cut while still inserted in the body, and doing so would be reckless. Therefore, it is extremely unlikely that a proceduralist would do this. Thank you for watching. If you enjoyed this content, consider liking the video. Leave us feedback in the form of a comment if you have any questions, concerns, complaints, or compliments. If you want to see more content like this, consider subscribing to see more footage like this. Till next time, stay safe.